We are officially live. Welcome, everyone. Karibu Sana to this amazing live we want to share with you. Together, my name is Dr. Jemima Kariuki. I'm the founder of Wills for Life. I am a mother and a happy one at that. And I really just want to thank Dr. Petrine, our pediatrician, who has come to help us with new babies to understand how to go about colic and reflux and how to the struggles of a newborn, but mostly gas, colic, and reflux because I am done dealing with gas. So thank you so much, Dr. Petrine, for allowing all of us to learn from your wealth of wisdom. I'll allow you to introduce yourself and then we can start.
Okay, thank you for that introduction. Hi, everyone. My name is Dr. Petrine Omondi. I am a pediatrician and I love to deal with babies. And I'm also a mother. So my practice got better with my baby. I learned a lot on the ground. So, yeah, that's who I am. And really looking forward to share whatever it is that I have, and also at the same time learn from you mothers also, because I believe that every opportunity is always a learning opportunity, and I'm happiest when I'm learning something new. So yeah, karibuni. I don't know, Doc, we can start off. All right, okay. So for today, we'll be talking about colic, reflux, and gas. And this is some of the things that have kept mothers up at night. I came to experience it myself, and I was like, what's going on? And that time, I remember you trying to remember what it is you've learned from school, because Vitu kwa ground is a bit different. But the understanding behind it at least made it easier for me to be able to deal with my baby, and made my anxiety levels a bit less. So I'll just start off. We'll start off with talking about reflux, and also after that we'll now go into the colic and then the gas, which will be also coming in between. So when we talk about reflux, what is reflux? Hey doc, uko sawa?
Yes, sorry, we're having a bit of a flux.
Oh, it's okay. It's okay.
So I wanted to let you know that we have our live stream. We having comments on the side, so
Okay.
everyone can leave their comments on their side. Tafadhali, have all your questions on the side. Please remember to subscribe, even as we start. And Dr. Petrine, just take us through. I know you have prepared much for us, and we'll be here in the background in case you need anything. I'll come later on to just highlight what the patients or the women are asking, and then we will go through after that.
That's okay. So I'll start off with reflux. So reflux is basically the bringing up of food contents from the stomach into the esophagus. As we were learning in school biology, we used to learn about the food pipe, which is connecting from the mouth to the stomach. That's what we call the esophagus. So reflux simply means bringing up food contents from the stomach back into the food pipe. And this is I can say it's a normal response for most babies, but there are times when it can be an issue. And then at that point, when it's become an issue, they're not gaining weight, they're always sick every other time, and they're having other difficulties. Then at that point, now it becomes reflux disease, what we call gastroesophageal reflux disease. And why do I say it's physiological? You find that as babies have been born, majority of their systems are yet to fully mature to the adult stage. And this also includes some of the muscles. Now, between the food pipe and the stomach, there's a certain muscle over there that is called the lower esophageal sphincter. Now, this muscle tends to gain more strength as the baby becomes older, learns to sit, and at that point is when you find reflux starting to reduce. So it tends to peak from at around 4 months, and then by around 6 months it disappears. But for majority of the babies, by the age of 2 years, most of them, they will have already gotten over the reflux. So in terms of what are some of the signs and the symptoms that a baby will be presenting with this reflux, and when should we be worried? So you'll find that most of the times these babies will bring up the food, let me say milk contents, after a feed, and it can even be up to 4 or 5 times in a day, which would be within the normal. Now, when they're bringing it up, you find that sometimes it will be of a little amount. There are those who might bring up a bit more, and it comes out gently. It doesn't come out like with a strong force that a vomit would come out. So that's one very important differentiating factor. And then again, some of the things that cause this reflux. Number one is if we overfeed babies, that can happen because they have a pretty small tummy. So when it's excessively full, then you'll find that the excess milk may have to find a way to go out, and which sometimes the easiest route would be to go back upwards the food pipe. That's one thing. And then something else is also the time after which we give, like, let's say once you've breastfed the baby or bottle fed the baby, if you put the baby down immediately, then that does not give the milk enough time for it to settle. So it can also go back up. Something else that would also be very important to find out that sometimes also may irritate some babies is in terms of when we're doing like formula feeding. It's very important to mix the formula correctly so as to avoid issues that may bring about reflux. So majority of the babies are what we call happy spitters, in the sense that they will be bringing up the milk every so often, but you find that they're generally okay. They have no fevers, they're gaining weight, they're meeting their milestones, and they're just happy babies. So those are the ones we call happy spitters. But in a case where you find a child is having multiple episodes of bringing up the food contents, the child is probably having fevers, the child is not gaining weight, the child is vomiting blood, or even having blood in stool, then those are not normal symptoms. Those are some of what we call red flags, and this is a point whereby you will need to go to hospital. In terms of its management, there are different approaches that we use depending on the type of the history that the mother will give, and also in terms of what we will find upon physical examination. So some of the ways that we manage reflux, number one, is we take time to take a thorough history so that we find out what is the length of time the baby is being fed. Is baby being overfed? Is baby taking in lots of food amounts at once? Is baby breastfeeding, or is the baby having formula feed? What is in the mother's diet? Does the baby have any other concurrent symptoms? So these are all things that help us have a rough idea of what is happening. And then after that, we now take the baby and examine from head to toe to find out if there are any other features that would be pointing to something that this could not be reflux alone, maybe it could be caused by something else. We listen to the chest to find out if it's clear, because in some cases where babies are having a lot of reflux and maybe they have a neurological issue, then they may come up with issues like pneumonia, because milk keeps going from the food pipe to the windpipe and into the lungs. So that can be one of the issues. So that's why we have to do a thorough physical examination to be able to find out, is this reflux within the normal or is it outside the scope of normal? So some of the ways that we deal with the reflux, number one, we advise do not overfeed the baby. feed the baby in, if it's a breastfeeding baby, you can do spats of maybe like 20 minutes, then burp the baby in between, and then you can give the baby more feed if the baby requires it. After that, you hold the baby in an upright position for at least 20 to 30 minutes before placing them down. And when you place them down, you put them to lie on their back. For some other babies, sometimes positioning may be of help, such as like elevating the head of the bed to like just like a 20-30 degrees, not crazy elevated. And sometimes we may even ask them to help the baby lie on the left side, because that may help to empty the stomach into the intestines as opposed to stomach to the food pipe. So that's one of the other things. And then if those measures do not work, then there's a role of helping the mother thicken the feed. The rationale behind this is that when you thicken it, then it becomes less liquid to say, such that for it to be able to climb up the food pipe becomes a bit difficult. However, this has to be done under the supervision of a medical practitioner, because you will need to weigh the risk benefit, considering that in babies under the age of 6 months, we recommend for exclusive breastfeeding, or if you're doing formula. So when it comes to the thickeners, there are different thickeners that are out there in the market. However, this would have to be done in consultation with your doctor. Something else for the mother is now looking into her diet, and something like milk, especially for children who have eczema, or there's a family history of eczema, asthma, or allergies basically, then sometimes asking the mother to eliminate milk from her diet helps the baby to reduce the episodes of reflux. So these are all what we call non-pharmacological methods, like methods that don't need medication, that can be applied to be able to try and help sort out the reflux issues. Sometimes when that has been done, but the baby is not getting better, then there's role for medication therapy, which can be used to try and suppress the acid production. And then we monitor the baby. If the baby seems to have responded after some time, then we wean off the medication slowly to see if the issue of reflux will have resolved. By this time, when you're getting to the medication, then we also now need to start thinking of involving other specialists, such as the stomach doctors for children, what we call the gastroenterologists, within the picture, to be able to now find out, is there something else that we could be missing that is making this baby have frequent reflux episodes that are impairing the growth of the baby is refusing to feed. Is there anything else that we could be missing? So basically that's what happens with reflux in children who are slightly older, because it also happens in adolescents, it also happens in older children. Some of the things that we may need to modify, such as lifestyle, because fatty foods have been shown to be able to increase the incidences of reflux. And then sometimes now when it's too much, then we now send them to the stomach doctors, because even allergies to certain foods have been shown to be able to cause reflux for this pediatric population that we have. So that is reflux in a nutshell. Maybe what I'll just say is that it tends to start happening from the age of 1 week and above. And then if you notice reflux that has started from day 1 of life, or before the first week, or a new set of reflux that baby had never been refluxing, then all of a sudden they're 6 months and above and they have started refluxing, then that is also something to keep in mind, because this one may prompt you to have a doctor's visit, so that you're able to look at why is this happening. So that's reflux in a nutshell. I think any questions surrounding it will tackle it in the Q&A session. Then now we go on to colic. So colic, we medically define it as crying for more than 3 hours per day, more than 3 times in a week, for a total of even more than 3 months. And this, for us, this definition was important so that we're able to know, is this crying normal or is it abnormal? Because babies can cry when you total, especially when in the early life, like let's say in the first weeks of life, they will tend to cry a lot, but normal would be between 2 hours, let's say, if you total the amount in a day. But now when it starts exceeding 3 hours, then we start thinking, is this colic? And now when most mothers come to hospital, they say the baby has colic, they automatically refer to stomach issues. But that in its case may not be 100% correct, because the stomach issues in this age group may be a part of colic. So, in terms of what causes colic, the exact cause is not known at the moment, but there are different theories that exist. From number one, whatever the mother takes in the diet, especially things like cow milk, specifically for mothers who have a history of allergy or even eczema, asthma, then whatever is in the diet can affect the baby. Sometimes you may find other foods like beans or anything that is going to cause gas in the mother would also pass through the breast milk and cause these symptoms for the baby. So that's one of the things. Something else that has also been implicated is in feeding techniques, whereby overfeeding a baby, underfeeding a baby, not burping the baby in between, basically any feeding technique that would make a baby uncomfortable, including also not mixing formula properly, then that has also been shown to cause colic. Something else that has been shown in the biological sense is that as the baby's the tummy system matures, then you find that they now get more of the good bacteria the older they become. So the younger they are, they don't have all that good bacteria. And now this imbalance may also affect them. So those are some of the things that have been proposed. There's also a role for psychosocial things, psychological things that may play a role in colic. Basically, if the mother has lots of levels of stress, then this can also transfer to the baby. If the household is not a peaceful place, then also the baby may manifest with colicky symptoms. So those are some of the common causes. Now, how does one know if this is colic or this is not? So you'll find that colic tends to happen mostly in the evenings. And by the time it's happening in the evenings, you find that this crying will be louder than normal. It will actually even sound urgent and probably very irritating for the mother and even the father. And sometimes they feel helpless because sometimes the baby is not consolable. So it will just start abruptly and then stop abruptly. So that's how it is. But you'll find even after checking for everything, the baby is fine. The baby has been fed, the diaper is okay, there's no fever, the baby is gaining weight, the baby is just generally okay. So that's what we define as colic, roughly. So apart from the crying, the other thing that these babies will do is they will look like they're writhing in pain, clenching their fists, drawing up their feet, and their tummy may become hard when they're in that process of crying. So that's how colic tends to manifest. And then you find as the night goes through and all that, by morning most of them are okay. During the day they're okay. Then when it gets to evening is when things are now starting to happen with the crying and it does bring a lot of anxiety within the households. So when should a mother be worried about this colic? If you find this baby is excessively crying, the crying has persisted for more than an hour or so continuously, You find that the baby has a fever, the baby is not feeding well, the baby seems to be in pain, maybe when you touch a certain limb or even any other part of the body, then those are not signs that are normal. You should be getting some medical attention. So that's something that is very important to know, because sometimes child abuse can be missed easily when you're attributing it to colic. And that's also something else that I think it's important to highlight, in the sense that as a mother, it can be very frustrating when you have your child crying through and through and through, and you're trying everything and nothing is working. Sometimes it does overwhelm a mother. I have been in a position like that once or twice, where it becomes overwhelming. But at that point, when it becomes overwhelming, it's important, if you have someone nearby who can hold the baby for you, please do so, at least even if it's for like 5 minutes or so, that you can take a breather and come back to your baby when you're a bit more calm. This will lessen the risk of you harming or injuring your baby, because sometimes it can happen. You may decide to shake the baby because you're like, why is this baby crying? And shaking for babies is not recommended, because it can easily cause trauma to the brain, and their brain is still very, very vulnerable, because it's growing at that point. So when you find yourself getting a bit anxious, a bit overwhelmed, and you're able to get help, kindly please do. That doesn't make you less of a mother at that point. Something else now, when we talk about colic, in terms of managing, how can we manage colic? So there are different methods that have been championed. Some of them, actually majority of them, are non-medical, like they do not involve the use of medication. So one of them would be like, just take your baby, carry the baby and rock them gently. There are babies who respond to that. The babies who can calm down to what we call white noise, like putting on some background music that sounds like the sound of rain or an ocean. There are those who, with a car ride, they just calm down like nothing ever happened. That's some of the things that you can do. For some babies, you can even go ahead and massage the tummy. That may help them. In terms of medical management, remember there was a point where I had said that they don't have all the good bacteria, the good microorganisms, as their tummy is still growing. So you'll find for some doctors, they'll prescribe a probiotic to be able to help with that imbalance. For some babies, it may work. For some, it may not. So it reaches a point whereby it now becomes individual based, but a good number do respond to that the probiotic. For those who milk has been implicated, sometimes if you withdraw milk from the mother's diet, the cow milk, then you find that some babies will actually respond. There's also a role for now, like for the babies who are being formula fed, because sometimes if they're not responding well to the normal formula they have, then they might be given other different formulas in which the protein has been broken down so that it is easier for them to absorb. However, this would need to be done under the supervision of a doctor, because sometimes you may lose out on something that may be beneficial for the baby. So this, and then also those formulas tend to be a bit more expensive. So it's best done under the guidance of a doctor. In terms of natural remedies, we find that there's
Hi, Dr. Ray. We've lost your sound. We've lost your sound. We still can't hear you. Okay, let's redo that. Can you hear me? Huh. Let me get you out of stage and then we see if that helps. Okay. Doc, can you try on the back end? No, can't hear you at all. Uh-huh. Just just relog back in. No, can't hear you at all. Uh-huh. Just relog back in. Hi everyone, just give us a few minutes as Dr. relogs back in. Just a few minutes. In the meantime, you can ask your questions.
Hello? Hello?
Finally, we can hear you. We can hear you well, Dr. Ray.
Okay. Thank you. Sorry for that.
Yeah,
So
we were tackling colic.
it's okay. At what point did I drop off? Maybe you can just let me know that I can pick up from there.
You can pick up from the remedies that one can use. You had just gone through how one can find out that they have
Okay.
colic. Then we stopped hearing you from the remedies.
Okay,
Probiotics. Yeah.
okay.
And
Apologies for that.
yeah.
Okay, so back to the remedies. So yeah, we've talked about the non-medical ways that you can take care of colic, and now the medications that can be used. There is the role for the probiotics. Then there is the natural remedies that have been used, such as fennel, such as dill seeds. Medically, the challenge that we have sometimes is that when we do what we call the Western medicine, which is what we learn mostly here in Kenya, we don't get a chance to really go into the herbal medications or the herbal remedies that are there. And so those are some of the factors that impede in terms of recommendations for some of these things, because we would need studies to be carried out on them to find out have they been effective or not. So some studies have been done to find out whether the dill seeds, the fennel seeds have been effective in managing colic, and we find some studies show that yes, they have been. Others show contradicting results. So because of such of these things, you find that it becomes a bit difficult to strongly go ahead and say we recommend using dill seeds, we recommend using fennel seeds. And this is where it becomes one of those things of what is happening versus what is on the ground. Because I found instances whereby mothers have told me that, yes, the colic for the babies worked and they were sorted out with Bonnie Sun or with gripe water and whatever else that is out there. So for me, what I would recommend is try the non-pharmacological, the non-medicative ways, and see if those work well and good. If not, then now there's the role for the probiotic and the other the other methods that we've talked about. So yeah, basically that's colic in a nutshell, and that's also reflux in a nutshell. And in between, you'll find that the colic would also be brought about because of having a lot of gas within the tummy, so that the gas spectrum falls somewhere in between. Yeah, so that's what I have for today. And yeah, we can have a look at some of the questions. Yeah. Let's see if
Thank you,
there's a...
Dr. There are a couple of questions. There are very many questions.
Sorry, can you see me?
Hi, can you hear me?
I can hear you. Can you
I
see
was
me?
on mute. Sorry. Can you hear me?
Yeah, I can hear you. Can you see
Yes,
me?
I can.
Oh,
So, yes, I can. I can see you, Dr.
okay.
So, Carol says she's learning. Oh, sorry, let me let you answer Carol
It's
as
okay.
I answer this. Sorry.
Okay. So thank you all for your questions. So I'll just start off with this is Carol Baish. Okay. So if you remove milk from diet, which I assume includes tea or Milo, what will you substitute it in order to produce milk? So when it comes to milk production, you may find that it's not only milk that you can be able to use to boost your production. We have from porridge, even water itself. We have the soups, the bone soups that you're able to do. So when you talk about let's use like maybe black cocoa. Black cocoa is one of the methods that can be used. So it does not necessarily mean that if you don't take milk, you will not have milk production. Yes, so that's something that needs to be clarified. So Sylvia asks, please redefine reflux. So reflux is simply bringing up of food contents that have already gone into the stomach up the food pipe. Basically, that's what reflux means. Food going backwards. Yeah. Then Twiri, thank you for your question. Daktari, does beef, chicken, pork cause colic as they are also protein? Not necessarily, because unless there is known to be any allergy, but not necessarily. Not necessarily. Yeah. Does processed milk cause colic? Whether processed or not, milk in itself can cause colic, especially if there's a history of allergy from the mom, or even if baby has things like eczema or no, not at that age, but eczema, yes, if there's a history of eczema for the baby, then it could be one of the things that can cause colic for the baby. Yeah, so these are the questions that I have here. And then some of the ones that I found in the chat earlier on the Wheels for Life group was in terms of, is it possible to avoid colic in baby number 2? So here, well, when it comes to avoiding, number one, maybe the best I could say is try and identify if there are any triggers that cause stressors within the mother, because every baby would come out differently. And then being able to know if you have any stressors during your pregnancy or during the breastfeeding period, then trying to avoid with them, that is one thing that may be able to help. Also knowing your diet, whatever it is that may cause gas in you may transfer to the baby. So that's one of the things. Just taking a note of when is it that the baby becomes colicky, what is it that gives you gas. Then when you identify such things, you're able to try and avoid. Another thing would just be feeding baby the right amount for that particular baby. Avoid overfeeding, avoid underfeeding, burp the baby properly with the proper burping techniques. So such things are the ones that can be able to help probably prevent colic in that baby. And then we've talked about foods to avoid in colic, which was another question that was asked. Now, for the mothers who have a history of allergy or baby has things like eczema, you may need to be careful about other foods that cause allergies. The most common ones are eggs, nuts, wheat, milk. So if you suspect something like this is done, which is causing colic in your baby, what you can do, you can eliminate it from your diet for like a week or two, and then see if the baby is still very colicky, then it shows that that is not the food that is causing that. So you just return it in your diet, because when you eliminate too many things at once, then you also risk having less nutrients within your body to pass to the baby. So that's something important that I thought I should mention. Another question that I got was, what are some of the natural remedies that are there for reflux? So some of the things that have been proposed, we have things like chamomile tea, fennel, and then something called lemon balm. Things like also gripe water have been used in the past, but for something like gripe water, you have to be very careful what is outside there, because some gripe waters have different ingredients in them. So be very careful, especially if you see any medication that has some sort of alcohol for the baby, then that's something that ideally you shouldn't be giving your baby. So just read every product label for every medicine that is there. And yeah, this is not to say that this particular one has alcohol or what, but just read for every dawa that is out there, read the labels. It's very important to know what is there. Yeah. Let me see. I think there's another.
Thank you, Dr. I can see a question here from Mary Jerry asking if how long does colic last?
Okay, thank you for the question, Mary. So colic can last even up to around 6 months, but it peaks in the early months, around 6 weeks, 6 to 12 weeks. Then after that, it starts disappearing. Sometimes it can even go up to 6 months, but by around four months or so, a good number of babies outgrow the colic. Yeah.
Thank you, Doc. Another question, I have a couple of questions that were asked. You've already mentioned about medications that can be used in colic. I'm saying here, what medications can we use for reflux?
Yeah, so for reflux, excuse me. So for reflux, before we get to medication, there are other therapies that have been proven to be effective, but most of the medication that is used for reflux would be acid suppressants, which is given for a certain duration of time. If there's a response, then you now titrate the dose downwards. Yeah.
Thank you. So majorly, we just use the what is this thing called? The natural remedies.
Yeah.
Okay. Sure, just a minute. Then I can see here, I read somewhere that babies who have these questions are mainly on reflux. I can see here that babies who are taking for milk only tend to have reflux. Is that true?
I haven't come across something like that, but if I'm to think about it, the hind milk would be thicker as compared to the fore milk. So I'm trying to think about it logically. I don't think that that statement is true. Yeah.
Okay.
Yeah.
Then I can see here my baby was sleeping and started producing milk out. I guess it just had reflux. Okay, started having milk spewing out of their mouth, is that normal?
So baby was just asleep and milk started pouring
Coming
out.
out of the mouth, yeah.
Okay. So sometimes that can happen where especially if baby has just been fed and has been put down to sleep immediately. And especially if they're fed for, like, let's say a long period, because you'll find that the whatever excess was in the tummy will have pandaed and then it comes out. So in cases whereby you see a baby is having that reflux, especially if it's a lot of it, then ideally what the mother should do is put the baby in a safe position to avoid choking. Sometimes that would even mean maybe turning the baby to the side for a bit until that stops, or even picking the baby up, putting the baby in an upright position so that you're able to protect the baby from choking. So that's something that's important.
Then this is not topic related, but I'll just ask you because you're pediatrician and I was asked.
Mm-hmm.
So um, this mom says that they have plenty of milk, but the baby is losing kgs. This is after 2 weeks. This is 2 weeks. Yeah, 2 weeks post delivery. They're losing kgs and they haven't attained yet their birth weight. So they're asking, do they pump or not? Because they feel like they have too much milk. So do they pump, and why is the baby not gaining weight?
Okay, so there are many factors that would need to be considered. If mom has a lot of milk and baby is not gaining weight, number one, is there an issue with the breastfeeding in terms of the latch, especially at those first 2 weeks? Is there a latch, a proper latch? Is there a tongue tie? Those are some of the things. There's a baby having infection, or is the baby sick? Those are some of the common things that would probably contribute to baby not feeding well. So can she pump? Definitely, yes, she can pump. And then maybe try and feed the baby via bottle and see if that would help. Of course, for this mother, some of the things that now would be very important for her to watch out for is the number of diapers that the baby has, because we encourage at least 6 to 8 wet diapers during that phase to be able to say that this baby is feeding well. So if the baby is losing kilos, generally there's what we call a physiological drop in the weight gain. When babies are born, they first of all drop their birth weight and then they regain it between 10 and 14 days of their life, which is roughly around, is it between 1 and 2 weeks, they regain their weight, their birth weight. So by 2 weeks, if they have not regained their birth weight, then we start questioning ourselves, is there something else? So those are some of the things that this mom can look into, and you can direct her to me. She can DM me, then we can be able to set up an appointment if she needs some help. Okay,
Terry,
so
thank you, Terry. There's this new question here.
yeah,
How do you know that you've overfed the baby? And
okay.
how long does it take to burp after feeding?
Okay. So, how do you know you have overfed the baby? So you'll find generally when once a baby is full, you'll find that they will just stop breastfeeding over there and they lose interest at that point. So trying to overfeed past that, then it becomes even uncomfortable for them. Some start crying after that, and when they have been overfed, it becomes also difficult for them to keep the food down, because it's the excess will need to find space to come out if it can't stay in the stomach. So definitely they will try and bring it up. How long does it take to burp a baby? Yo, from my experience, eh, it would range from 5 minutes to 20 minutes. You would just be there like this. So what I would say is, as you're doing that burping session, just be patient. Just be patient, because it really does vary, by the way. It can really vary, to be honest. Yeah.
Thank you for that. You've reminded me how long it's taking to bap this one. And sometimes you bap them and then they wake up. You're like,
You know,
okay, you're
you know.
supposed to go to sleep. But I've realized husbands do it better. So if you have your partner,
Oh yes, that is
just do it.
100% true. I would actually breastfeed my son, and I'm like, here,
Yeah, I don't know how they do it, and I don't know what magic they have, but
yeah, me, bapping. I removed myself from that one. I say that's duty, not mine.
attachment. You and I both. Yeah,
Hmm.
but I get that. I'm seeing when do you stop giving babies a bap? Also, on the same topic, by the way, if you're bapping a baby and they pass gas, like on the back end, does that
Hmm.
count like bapping, or is it just passing gas and you still have to wait to bap? Like, yeah.
Well, now that is something definitely I was not finding in books. So I learned um, the end goal is to have gas being passed, right? So whether it comes through the front or back, me, I was okay because you just want wind out. Yeah. And then, sorry, there was also the other question for there was something else you'd said about the when do you stop giving babies a bap. So your baby will guide you when to stop bapping them, because as time goes by, as they approach 6 months, especially once they learn how to start sitting, you find that they regurgitate less. So as they regurgitate less, then you'll need to bap less. Then it just becomes automatic at some point they stop. Especially now when you start introducing the complementary feeds, by then you don't need to be bapping them. Yeah.
Okay. I wish there was a way you could. Oh, Jesus. I don't know how to put this phone apart. Just a minute.
It's okay. There's a question here. What happens when a baby doesn't burp? So when they don't burp, it becomes uncomfortable for them because you find that they have milk and then now they have air within their tummy. So now that air makes them uncomfortable. So you'll find they are probably, if you wanted to breastfeed them again, it may become difficult for them, or they even just become irritable. So, and then after some time, when you put them down to lie, then they may also regurgitate at that point. So the burping makes it easier for them to be able to, settle down. And then even if you're to breastfeed them, at least you've made some space by clearing out that extra air. Yeah.
Okay. Thank you, Doc. Question related to this newborn phase. Is there particular foods recommended by the pediatrician for moms to eat for the sake of their babies, or anything goes? And is there something that is not recommended for the moms to take?
Okay. So I would say in terms of food, do you like just do you, because how I react to beans and how you'll react to beans will be different. So do you and learn what works for you as you go. For me, that's the advice I would give. And of course, what is not recommended for moms: alcohol, smoking. Those are the ones I can think of at the top of my list. Yeah, those
Okay.
ones. Yep. So those ones, please. There is no
Avoid
benefit for the baby. Yeah.
this long question.
There's a scenario I saw at my friend's house. Her baby was sleeping peacefully, then out of nowhere, baby started choking for no apparent reason. Could that be related to reflux? So this now enters to a certain spectrum, depending on how severe it is. Because the reflux can come up, then if it comes up and goes towards the windpipe, then that can result in choking. So that can be something that is scary to see, especially sometimes if a baby chokes and then loses consciousness. That's now enters the spectrum of what we call acute life-threatening event for babies, for which now you need to find out, is it just reflux or is there something else that happened? So now that's a different spectrum. However, reflux that goes the wrong way can lead to this. Yeah,
Wow, that's quite scary. But at least
it
you know about
is.
it in time. And like the message is to bark, bark, bark before you put that baby down.
Please
And
burp.
yeah, and if your baby is one of those ones who have reflux, 20 minutes on your chest or whether on your hand. Can they be on your hand? Is that safe, or do you just need to put them on your chest for those
Like
20?
when you're holding them or
Yep,
up.
like this. Is that still chest up, or do you need to put them upright for 20 minutes?
So it's recommended to keep them upright.
Mm-hmm.
Yeah, upright. Yeah.
Okay. So upright for 20 minutes after breastfeeding. Yes, Papa.
Yes. Even after formula feeding. Eh?
Even after formula feeding. Okay.
Yeah.
There's a mom here concerned. There.
My 1 week old baby is not burping no matter how long I let him stay upright. What can I do? Um, so,
Techniques.
so yeah, the burping techniques. I wish I had a doll here somewhere.
Actually,
Okay,
mine, but
so
I'm not sure I'm doing the right thing. So
so actually, just give me 1 moment. I think I have a doll somewhere here.
no problem, Dr. Ari. So thank you everyone who's still on the live with us. As you hear and as you wait for Dr. Ari, kindly ask all the questions you have for the next 8 minutes that we still have with Doc.
Okay, so this is my other son, and we shall burp him. So, when you're burping a baby, the at the back, so between the what we call the shoulder blades, there's a space in between there. That is where you place your hand. And when you're burping the baby, use the palm of the hand. The palm of the hand or the shin, not the fingers, because the amount of pressure that you apply is important in trying to help the burp be effective. So he's pretty small, but anyway. So as you're burping, gently apply that pressure in between the shoulder blades like that, or like that. But when you do this, it's simply as if you're just touching the surface like this. So the pressure is not as effective. So that's why you have to do like that, either with the with the heel of your hand or the palm, but not the fingers aspect. So as you're doing that, and you also make sure that the baby's head is slightly over your shoulder, not just like that, slightly over your shoulder. So that now you ensure that the technique is effective. Then once the baby has brought up the wind, then that's okay. And definitely it's a given. Sometimes you will stay there for even 30 minutes or so. It's not working. It's okay to take a break and just see how the baby will be. Yeah. Okay, let's see.
There's another burp related question. Just a minute, and then we'll go back to the heat rush. How many burps should you hear to know that the gas is completely finished?
There is no recommended number of burps that you can do. You just do it for as long as you feel that, okay, baby has relief. Because with time, your baby will develop a pattern that will show you that, mommy, I'm okay, or mommy, I still need to be burped more. Yeah. So there's no recommended number of burps, like saying 2 burps are enough or 5. There isn't. Yeah.
Okay. Then there's a question here. Oh, before we go to the heat rush question, we've seen that there are 3 techniques apparently. There's this one that I am currently doing, I was attempting to do as you are doing. And then there's the one for sitting down, the big and what is the other one? The one for almost tummy time. Maybe you can
Yeah.
show those ones.
Okay, so the other one is if you're putting the baby to like, let's imagine this baby seated on my lap. So if you're putting the baby to sit or even just lie slightly on your lap, you're supporting the head using this part of the. You're basically using the below the chin. So you're making sure that you're not strangling the baby. Okay, and then sometimes you may also just support with around the chest towards the shoulders, depending on how big or the baby is. So as you're doing that, you're now applying pressure on the same back area that we have done, like that. But now you're holding the baby in this fashion. Yeah, I wish this baby was a bit bigger so I can show that properly. And then there's one which if you just place the baby on the tummy as if they're lying, sometimes that it's the pressure that you have put on the tummy when they're lying on their tummy that brings up the wind. However, if you do that, you have to make sure that their head is in a position in which it will allow the gas to be able to come out. Yeah. Then so there's this question, if a baby doesn't burp and you put him on his side, sleeping on the side, is it safe? So you can put the baby on the side, that's okay. If you're going to put the baby on the what we call to lie on the left side of to lie on the left side. However, even better is if you can just slightly elevate the head of the bed, just slightly, by like 20-30 degrees max. Yep.
Can you use a pillow, Daktari? Can you place
uh
a
no, 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 not a pillow, because the risk is if you use a pillow, you see the baby won't be able to keep their head or rather than the airway open nicely. They can easily even do this because the pillow is behind there. Now because of that, they breathing can become an issue. So pillows, no. And then it can be easy for them to suffocate with that. So no pillow.
okay.
Yeah.
Okay. Then I can see when do we stop burping? I think you mentioned that. When by the time you're going to feeding, they should have shown you they're okay with burping themselves,
Mm,
right?
yep.
There's a trick here by Joy. Yeah, you can just read for me, Doctor.
Oh, another trick I was shown with my second baby was making sure the legs of the baby are folded while in the upright position. It worked faster. I wish I knew with my first. Oh, wow. I have learned something new.
Okay,
Interesting.
effecting it from today. Thank
Yeah,
you.
it makes sense because when you bring up the knees, you're kind of increasing the abdominal pressure,
Gotcha.
which
Yeah.
will push up. So, wow, interesting. I've learned
Yeah.
something. Thank you, Joy. Now I'm
Thank
going to
you,
sound like
Joy.
it.
Yeah.
Yeah, something new to teach my patients. Thank you.
Kabisa.
Uh-huh.
Then there's a question here.
Yeah.
Quite often when I burp my 2 month old, she tends to suckle on my shirt as she rests on my shoulder. Does that mean she's still hungry, or is she just being a baby?
Please feed baby. Please feed baby. Yeah.
She's
So
still
sometimes we burp the baby just to give them a bit more room to be able to take in more milk. So if you're still hearing the suckling noises, just offer baby the milk until baby now loses interest. Then you'll be knowing our baby is full. Yeah. Or dozes off to go sleep. Yeah.
okay.
Mm.
Joy, thank you so much. We have 2 minutes in this live.
Yes.
There's a question here on da, 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 da. Please speak about heat rash. Yeah, where was that heat rash question? Here. Mm, yeah, but just can you speak about heat rash? I guess this mom is just concerned about what happens when the baby has heat rash. This is Victoria.
Okay. So heat rash. So there are times when excessive dressing would be able to probably bring about what you're calling the heat rash. So basically, as it is, or some babies in places like maybe where they sweat a lot and all that, some people may develop a rash because of that. So basically, how do you manage this? Just don't overdress the baby. Dress the baby according to the temperature of the place, or yeah, there's normally some dressing chart that exists so that you don't have to underdress or overdress your baby, just dressing them right. And this can happen mostly especially when it's at night and babies are overcovered, overdressed. Yeah, so that's it. Though you'll find many babies have some rashes that you do not need to intervene. It's more of just letting them take their course. Others may need a medical intervention. Yeah.
Thank you, Doc. Um,
Aribu.
if you hear my
Yeah.
son in the background, just accept it for now. Monique was starting a question. My baby, my baby. I don't know what Monique wanted to say. Yeah. Then Victoria talks about, oh, my baby 1.5 years gets hiccups, then vomits occasionally. How do I manage it? While you're speaking on hiccups, newborns also have hiccups. So I think we can tackle that as our last question. Newborn hiccups and hiccups in babies in general, because this one is
Mhm.
1.5. Vomiting, vomiting frequently, occasionally, sorry, and the management principles. And then Victoria says we share the chat. I think we can do that on the Wills for Life platforms. So you can answer Monique.
Okay. So baby that's 1.5 years gets hiccups and then vomits occasionally. How do I manage it? So, a hiccup can happen when basically what happens with a hiccup is there's a nerve that helps the diaphragm work properly. So, when you have overstimulation of that nerve, then the diaphragm keeps contracting. So that is what brings about the hiccups. Now, some of the things that will make the someone get hiccups, there's that which can come, especially when you're very full. So, when you're getting lots of hiccup and then vomiting occasionally, that means that the pressures in the tummy are being interfered with. So, maybe like after you've eaten and then you're very, very full, you'll find that this can happen. Um, and then now, yeah, so this can happen, especially when someone is very, very full. Sometimes with children, especially the ones who are directly fed, there's risk of overfeeding because it's like food is just being given to you. You may not have control of how much is being given to you. And then also for children who are fed when the other activities such as the TV being on, they're not really paying attention to the feeding. It's more of it becomes like a passive activity. So these are some of the things that one has to keep in mind so as to avoid the concept of overfeeding, because the hiccups can happen and then the vomiting. Yeah.
Thank you. I've also noted with this particular baby, if you don't bap them and then you put them down, they'll either reflux or they'll
Hmm.
hiccup.
Yes.
So that's just something out there.
Yeah.
Then please share remedies. We will put this live for all of you to be able to rewatch it. So don't worry, you'll be able to revisit and rewatch. Can you share the chat, please? If you're Wills for Life mom, just we'll have it on the Wills for Life groups, especially the Gold platform for everyone who has had their membership. Yeah, but this will also be um, live on the app. Baby, just a minute. This will also be on the application for all of you to see and keep watching them for a long, long time. Yeah, so Petrine, yourself, and I are going to be on your screens for a long time.
Yeah.
Third, we want to thank Dr. Petrine so much uh, for her time here. I don't think there's another question that we have not responded to. I really want to thank you, Dr. Petrine. You've been amazing on the group, answering all these moms, myself included. Thank you, Baba. Yeah, you've been amazing on the group. You've been amazing here. Thank you for giving your time out of your child's and husband's time to be with us. We're grateful. If you have any other questions, kindly please, moms, do really just ask on the platform. You can even leave a chat here or comment on the live. Oh, sorry, on the YouTube. We shall be able to get them to Dr. Petrine. All moms, Dr. Petrine is available. She's available for consultation. Doc, where are you found? Where are you? So that we know where to come look for you physically
Okay.
now and
So
virtually. Thank you.
currently, I'm physically found at the AR hospital and also part of their clinics. So, should you want a consultation with me, just send me a DM and then we can arrange because different days I'm at different areas. So, one will just need to DM me, then I'll let you know where I am. Yep.
Thank you. For those in the Will to Life app soon launching, so you can also book for time with her on the app, so that you can be able to book your consultation and get time with her. Doc, thank you. You have been good to us, and we also want to thank God for just giving us all this time. Apologies for my babies, all of them making
It's
noise on the
okay.
many phone
It's
calls.
okay.
Sincere apologies, but thank you. I see one last comment here. Let me see if it's something. Yeah, all moms are saying thank you. This has been such an informative session. This is helpful. Thank you. Oh, this is so good. Thank you, mom. Give her her flowers while she's here, please. Comment on the chat. Let her know she's been of help to all of you. Thank you so much. And please, mom, subscribe if you haven't subscribed. While we still have you on the live, please just hit subscribe on that channel, like and share. We appreciate all of you for taking your time to be with us as well, moms. Thank you for chatting and engaging with us. We know it is not easy, especially if you're holding young ones like I am. So be blessed, all of you. And yeah, Barikiveni, we will stop this stream in a minute. Thank you so much.
Asanteni sana, and thank you, Joy. I have really loved that tip of yours. I shall be trying it.
Karibu. Mary, thank
Thank
you.
you, everyone.
Thank you.
All right. Have a lovely evening.